Here you can see the Cellon method for gentle treatment of hyperplastic nasal concha using the Cellon ProBreath applicator. In this way you can effect a submucous volume reduction of nasal concha without disturbing the ciliated epithelium, important for the proper function of the nose. The anesthesia used is superficial, for example 2 sprays of a tetracaine aerosol into each of the nasal cavities. It's recommended subsequently to place swabs soaked in a 4% tetracaine solution around the inferior conchae, leaving them in position for approximately 3 to 5 minutes. To ensure complete lack of pain, we recommend an injection of 2 to 3 milliliters of a 2% lidocaine solution without adrenaline into each of the conchae and distributed over their full length. Following the superficial anesthesia, an injection of lidocaine has the advantage of enlarging the volume of the conchae during the operation, minimizing the risk of mucous membrane damage. No vasoconstrictive substances should be used prior to surgical intervention, since these induce a temporary volume reduction of the nasal concha. The size of the coagulation arising depends on the power setting of the control unit. This interdependence is inversely proportional. In other words, the higher the power setting, the shorter the application time and the smaller the coagulation. A power setting of 15 watts is recommended for the treatment of nasal concha. The applicator is inserted into the front end of the inferior concha and pushed forward to the rear end of the concha below the mucous membrane. To attain optimal results and retain the function of the ciliated epithelium, the electrode should be positioned as close as possible to the middle, between bone and the mucous membrane. After positioning the probe, the power supply is activated by pressing the foot switch. The status of coagulation can be controlled by the acoustic signal. The increasing pitch of the signal indicates the progress of coagulation and the increasing tissue impedance. The power output is controlled automatically. Completion of the coagulation process is signaled by a high-pitched interval sound. The power supply is reduced automatically. Overdose effects are excluded. To obtain coagulation over the entire length of the nasal concha, the needle is withdrawn around 6 to 8 millimeters in each case and the power control unit reactivated. The marks on the probe shaft indicate its position in the process. This procedure is repeated until the whole length of the nasal concha has been treated. Following treatment, physiological salt solutions and ointments containing dexpanthenol can be used. Tamponades are not needed as a rule, since no bleeding normally occurs. Volume reduction is apparent after a period of 7 to 10 days as a result of scarring and bodily discharge of the coagulation. A temporary deterioration of nasal breathing is possible for a few hours after surgery until the therapeutic effect becomes noticeable. The patient should be properly informed about this effect. The patient should be recalled 2 days later for the purpose of checking the results and removal of any fibrin formed. We wish you much success using the Cellon method. For further information, please contact Cellon directly or visit our internet site at www.cellon.com.